Okay, good morning. Well, good afternoon now, I should say. It's my absolute pleasure to welcome Dr. Richard Doughty today for this webinar. The webinar is being recorded, and as usually happens, the majority of people will watch the recording afterwards. So if I could remind everyone here to please be respectful whilst Richard is doing the presentation. And if you have any questions, to please put them on the chat, and we will then ask him at the end of his talk. So Richard Doughty is an absolutely incredible chap who literally is one medicine in human form. For not only is he a qualified vet, but his passion and his curiosity for comparative pathology and to learn all about the different species means he went back to university to study human medicine as well. So he's now a medical doctor, a pathologist in Norway, and here he is, thankfully, to talk to us about foot corns in humans and dogs. So, Richard, over to you.
Thank you very much, Joe, for that very kind and flattering introduction. Today I'm going to talk about the one medicine approach we've had to understand corns in both dogs and humans. And I'll take you through the story or the adventure we've had looking into that. First of all, I just thought I'd say a little bit about my day job. I'm a pathologist, an interventional pathologist who specializes in diagnostic of predominantly cancer. But I still retain this interest in sort of looking over the fence to animal medicine, veterinary medicine, and see how we can compare, how can we learn between the two professions. And I think there's a massive scope, and that is really embodied in the charity Human Animal Trust. Just a slide that probably you've all seen is this really encompasses the one medicine approach, this sort of interchange of information between human and veterinary medicine, and sort of seeing how can we learn through the naturally occurring diseases that we have between different species, and what can we learn from them and how we can use it to develop better treatments and a better understanding of the diseases. So this is really where this talk will be concentrating on the convergence of areas naturally occurring spontaneous diseases and comparing differences between the species. And this is more of a focus where maybe one medicine can really add value in the process. So you can see cancer, infectious control, antimicrobial resistance is an obvious one, neurological conditions, regenerative medicine, diabetes, obesity. But today we're going to focus on other diseases, and we're going to go right to the end of the body, to a much often sort of ignored area of the body, the feet or the paws, if you'd like. And what's so fascinating about this topic is the diversity. It's probably the most diverse structure we have between animals and us. There's such a wide variety of different types of feet, and I'm pretty sure we can learn a lot about our own feet and a lot about the feet of animal by studying the comparative aspects of that. Even within species, even within the dog, for example, there's a massive variation in anatomical variation. So here you can see a Doberman with its very broad, like what they call cat paws, very broad and massive, thick foot pads, to the greyhound, which has a very sort of delicate hair-like paw, thin, not much fat in the fat pads, and then you have a retriever, which is pretty much a mixture of the two. So how did I come to pick this topic to look further into? Well, it was really when I was a veterinary surgeon. I was working at the Royal Veterinary College as a pathology resident, and I started to work as a locum at a greyhound racing track in London, and started to sort of see these dogs a lot more in my clinical practice, and started to notice that they often get these corns, these little focal lesions on the bottom of their paws. You can see here's a sort of whole range of how these corns can present, from really quite discrete little dots through to massive areas of buildup of the outer layer of the skin, the keratin area. And when I was looking at these, it really just reminded me of what we see in the human foot. Corns are quite a large problem in humans, especially in the elderly population, especially also in the group that are obese, have obesity problems, and also diabetes. So it's of great relevance. They say that around sort of 10 to 15% of humans have a corn, and often they're treating them themselves. They're often quite debilitated by it, but there's very frustrating to treat and no real effective treatment. So my interest in is what can we find out about corns in greyhounds, and what can we find out about corns in humans, and how can we learn? Is there anything we can learn between the two? Essentially, taking the one medicine approach. Here's another picture just to show how alike they are. If you see, these are post-mortem specimens of greyhounds, but you can see a central hard core of keratin, and exactly the same in the human. And you can imagine having that in the bottom of the foot, how painful it is just to go. And while it's not cancer, it's not an infectious disease, it's an incredibly chronic, debilitating disease. So just as important, but often overlooked. And here, just to show the point, I've got a film that was supplied to me by Mike Gilliard, who's a greyhound vet. And you can see as the greyhound walks, it's not just limping, it's literally not putting any weight on that foot that's got corns, because it's so painful for them. This really does limit their life and their ability to exercise, to go out and enjoy and run around. And the exact same happens with humans. They tend to be much more sedentary when they have these problems. So what will this talk cover? It'll cover a little bit about my research into the epidemiology, the pathology and the clinical studies related to corns, and also a little bit about the genetics. And during this talk, I'll try and sort of bring in a bit of information, a bit of comparison with humans. So first of all, we wanted to find out, is it just greyhounds that get corns in the dog world? As you can see, even within, let's say, if you say the sighthound group, the running group of dogs, the group that really use their sight to run very fast after prey, there's a massive diversity. So is it just greyhounds, or is it that group as a whole, or is it dogs as a whole that get these corns? And this could maybe tell us a little bit about why these animals get corns. So we did a survey. Well, what we knew about it was Svein from the veterinary school in Alabama did a survey and found out that out of 484 greyhounds, he found that really they often had a location on the end digits, the little toes at the end. And he didn't find any association with, let's say, an earlier race injury. He didn't find any association with weight or sex, and there was no difference in location between the paws. This is a little bit different to what we found in our research, but I will go on to show you what we did. So to confirm this, we did a postal and e-survey. We contacted groups, greyhound and sighthound groups on Facebook, and also sent out surveys to breed societies. And we wanted information about the age, the weight, what breed, what height, sex, color, anything that might give us a hint as to why these dogs might be getting corns, and also build a picture of what is a dog that gets corns. So we had a massive response. We had 12,348 dogs in the database and 20 different breeds. And this is what we found. We basically found that we never had any confirmed reports of corns, of definitively diagnosed corns in any other breed other than really greyhound, whippets, and lurchers. Lurchers are basically greyhound or sighthound crossed with another breed. In this case, we only ever found corns in lurchers that either had greyhound, half or half whippet. So this really pointed us to, this is a problem predominantly greyhounds. Whippets were also the smaller cousins of the greyhound, also had a problem, but to a lesser extent. And we noticed when you started to dilute the greyhound genes and whippet genes, you still had the corns there, but at a lower incidence. Here you can see greyhounds, typically racing greyhounds, were around sort of 9 to 10%. With the epidemiology, we found that increasing age gave us an increasing instance of corns. As you can see, as you get older, and it sort of peaked or started to level out at around sort of 7 to 8 years old. And this is pretty much the same situation with humans. While young people, especially with maybe toe deformities, can get corns or badly fitting shoes, we do know that the incidence of corns gets higher and higher as we get older. Does sex matter? Well, we, as opposed to the previous surveys, we found that in fact males were predominantly had a higher incidence than females. And we could postulate, was this because of weight, for example? Also, we had some comments that maybe it's only racing greyhounds, because there are two types of greyhounds. They've really divided themselves between sort of show greyhounds and racing greyhounds. And there was always a belief that it's only racing greyhounds that have these corns. But in fact, when we looked at the data, in fact, they were evenly spread. So again, just under 10% incidence between in racing greyhounds and show greyhounds. And the same with whippets. Also, we want to know, is there any particular paw that is affected? And we found that front paws were more commonly affected than back paws. Of course, we can't compare this with humans. We have hands and 2 feet. We don't have four paws. Also, we found the 2 central digits, 3 and 4, were most commonly affected. The same in the back. So this really pointed to, we know that these 2 central digits in the toes in the greyhound are in fact the weight-bearing ones. It really started to sort of point us into the direction that maybe it was weight or a mechanical trauma that was causing these corns. The next thing we wanted to understand was the pathology of the lesion. There was very little work done on what actually these looked like when we looked at them under a microscope. So we wanted to see, because that can often give us indications as to why they occur, and also what other damage they occur and how they occur. So just a little bit about the anatomy of the dog's paw. You have the digital pads. Those are the little pads at the right at the end of the toes. And also you have the metatarsal or metacarpal pad just behind the bigger pad. Also, you have a digital pad up where the dew claw is, and also a carpal pad on the front paw. That's the little pad very high up on the leg. Just to compare with humans, here you have humans, of course, they stand what we call plantigrade, so they stand with a very flat foot, as opposed to dogs, which are essentially standing on their toes. So this is just a microscopic image of skin. You can see here this overlayer here. At the top is a very thick, what we call a keratin layer. This is protection for the skin. And then when you see underneath, here is the layer that keeps regenerating, the epidermis. And then underlying this is what we call the dermis, which holds everything together. This underlying dermis is essentially when you make leather, for example. That's a very tough material. If we look at the human situation, so here is a corn in a human, and after biopsy, you can see that you get a very, very thick, hard core of keratin, which sort of pushes down into the underlying epidermis and underlying dermis. And in these layers, you get many, many nerves. So you can imagine if you've got this sort of hard material pushing down on the dermis, you're going to start to get pain, almost a feeling. The typical feeling is I have a stone in my shoe, and it's just constantly there. To compare with the dog, I just want to say there's a few anatomical differences. For example, when you look at your dog's paw, you'll see lots of little ridges. That's what we call papilla. And these are essentially designed to give a little bit more surface area grip. So the dog, when it's on ice and when it's on something slippery or when it's running, it has much more grip than when it does that. And you can see here, you can see those sort of almost like frond-like, a brush-like papilla. And here you can see it again, some church spires here. These are what we see when we look under a microscope. Also, when we look under the microscope, we can see that you have exactly the same picture. So you have a very thick, hard core of the keratin, almost like stone-like material, that pushes down into this E, which is epidermis, is underlying layer of skin, and also the underlying layer of the dermis. This on the left is a post-mortem specimen of an amputated toe, and you can see that this is the bone, what we call P2. So this is the bone before the toenail, and here's P3, which is the toe that's sort of the bone that connects to the toenail. And you can see underneath, which is marked C, is where the corn is. And interestingly, you can see that bone sort of overlying where that corn is has started to sort of destruct because it's getting so much pressure from the corn. Also, where the star is, a little fluid, what we call a bursa, is developed to try and protect that bone because of so much irritation. I just wanted to show you these 2 pictures because these are the pictures you've just seen, just to show you that the human corn and the greyhound corn look absolutely alike. If you see them, you wouldn't really be able to tell so much of a difference. So this is a really good model to sort of pass information between human medicine and veterinary medicine. The next question we had is what causes these lesions? And we had 3 suggestions. One could be a virus, a papillomavirus, a little bit like a wart on the humans. Stress, traumatic, there's maybe a foreign body or something like that is getting into the toe, and chronic mechanical damage. So that repetitive hitting of the bone on the skin causing a corn. So first we wanted to look at whether it could be caused by a virus. We collected up 350 samples. We did PCR, which is a sort of molecular technique which looks for little fragments of DNA, which is specific for papillomavirus. Also, we did immunohistochemistry. This is when we stain tissues with markers for that virus. And also we did electron microscopy, which is looking even more detailed, where you can actually see the virus through that technique. You can actually visualize it. We did 6 samples. The reason we only did 6 for that is it's very costly. Also, it takes a lot of time, and it's quite hard to get the samples for that because they have to be sent in a particular type of fluid. We did with PCR. We never found a positive for papillomavirus. With the slides, with the stains on the slides, we never found a single evidence of positivity in that. And also electron microscopy, we never found any virus particles in there. So we felt after that we could fairly confidently say that papillomavirus wasn't the cause of corns. And this fits with what we think in humans, where we know that they aren't really caused by that. They're probably caused by mechanical irritation. The next one was traumatic scar tissue from foreign bodies. This was quite hard to detect because if you see on this radiograph, you can see that toe to the left hand side. You can see a little dot. So this is an X-ray of the dog's toe that came in with a corn, and you can see if you look in the center of that red circle, you can see a little bit of a dot, more white dot, and that's the foreign body. So that's a particle of stone that has been embedded in the paw and created a corn. So we know it can happen, but it's very, very rare. Here you can see when they took a biopsy of it, that you can see almost this on the left is the overlying skin, and you can see almost like it looks like something's exploded into the underlying area. And that's because a foreign body penetrated through and then created irritation and a corn. This is a picture sent was sent to me by a colleague in Australia, which showed that, yeah, you can get stones in the paws, and you can see here an embedded bit of gravel straight into the paw. So we felt that while it can be a cause, traumatic and foreign bodies can be a cause, we felt that it wasn't the most common. The next was, could it be mechanical trauma, chronic mechanical trauma? We know that greyhounds are very thin. They don't have much fat tissue in them. So we knew that maybe that makes them, they don't have so much padding in their paws. So maybe that made them predisposed. And here you can see again the amputated toe picture. It's a cross section. Here's the down at the bottom is where the foot touches the floor. And you can see P3, that's the end bit of the bone of the toe. And here you can see A, that is fat tissue. And you can see there's very little fat tissue here and no fat tissue where just where the corn is positioned. So we came to the idea that probably it's this repetitive chronic trauma combined with the possibility of maybe there wasn't so much fat tissue underneath. And we know this is a situation in humans as well. Here is a nice technique. It's what we call nano CT. So it's basically using CT scanning at a level of what a microscope might see. And you can see here, this P3 is the bone at the end where the nail attaches to. P2 is the next bone. And you can see where I've marked B. There's a little fluid-filled area. And this shows this is where exactly over where the corners lie. So it's a fluid that's formed there, essentially trying to sort of protect the toe in a different way. But you can see where the star is on both pictures. We can see there's also chronic tendon damage. So it sort of indicates to us there's probably an element of damage that's occurring all the time and just building up over time. And this would also explain why most dogs who get corns are older. Here is a picture which is quite dramatic. You can see again, here's the skin on the right-hand side, and you can see the bone has basically pulled away from the bone. So there's been so much pull from the tendon to the toe bone, that it's pulled a fragment of bone away, and that's acted like a stone from inside the skin to create the corn at the top. So we know that trauma can cause corns. So we focused on maybe chronic mechanical damage was the main cause. Why greyhounds and whippets? Anatomical differences. They have very thin paws. They have very small paws relative to their size, very narrow, and this can probably give them. If you think about a Doberman, which is on the right-hand side, you can see how thick their paw pads are compared to greyhounds, which have incredibly bony feet. Also, there can be anatomical abnormalities, what we call some minor toe defects, and these can result in abnormal weight bearing on the pad and lead to corns. If you compare this with the human situation, where we know, for example, everybody starts out with a normal fat pad just under the heel when they put their foot down, and the ball of the foot when they put the foot down. But over time, and because of maybe other sicknesses, such as, for example, diabetes, where we know maybe where you get a chronic wearing and fat atrophy, you can develop corns there. So we know, for example, that a lack of fat, a lack of fibroadipose, which is fat tissue padding, can also be predisposing to corns. Here is some foot pad data. It's quite hard to see, but we can see that, for example, the chronic mechanical injury is really supported by the fact we know the two central toes, which are the most likely to get corns, are also those that are wearing the highest weight when the dog puts his paw down. So once we were quite satisfied that, okay, it's not a viral, it's not a foreign body, we decided to look into how can we treat this. And in medicine, when you have many treatment options, you know what it means is, in both human and veterinary medicine, there's no good treatment. And you can see these are all the treatment options for digital pad corns. They're exactly the same as humans. So you have abrasion, you can cut them out, you can do surgery to cut out the whole lesion, or maybe do a cut the nerve so that the animal or the human doesn't feel it. Also, you can use things to sort of hydrate the skin, also things to break away that hard tissue. We can all get those from pharmacists, for example, to break it down. Also, people have tried antivirals when they initially thought it was virus. And also, you can also do the same as what we do with humans, which is offload the weight from that. So you can also find special paw boots for greyhounds that offload the weight from their toes, so they don't get it. Much like you might get if you went to a podiatrist, chiropodist in the human situation. The other is that injecting silicone to create a bigger pad has been tried. And these are probably the most common things that have been tried in veterinary medicine, to take out that hard, essentially sort of pull out that hard stone-like material, cut it away, or just inject something to increase the pad. Here is a picture of how we take out the corn, the hard corn. You can see this is a colleague in the US who took these photos, and how he gets that hard bit of tissue out and leaving a little defect. The problem with this is it grows back within a few weeks. But here you can see a human podiatrist doing exactly the same with a scalpel. And this is bread and butter work for podiatrists, chiropodists, cutting out corns. The treatment really hasn't changed over the last several hundred years. And in fact, many royal courts in medieval times had what they call corn cutters, who would cut out the corns of the royalty when they had them. So this is really a sort of problem that the treatment for it hasn't really developed over time. Here you can see when you remove a corn with a scalpel, a human corn or a corn plaster, they're pretty much going to come back again. So after a few months, if you take out the core, half of them are back. And if you use a corn plaster, probably 75% or 25% come back. So this is one of the standard treatments that was here maybe 5 years ago when we didn't have anything else, where we would just cut out the corn and let the paw pad heal. Silicone injections have also been tried, first in humans and secondly in animals, in dogs. And the problem is it does give you some relief, but the silicone starts to spread, or the filler starts to spread around the body. So it's only ever maybe a 2-3 month solution. because the weight pushes the filler to other areas. So my colleague, Mike Gilliard, who I've had a long collaboration with, fantastic orthopedic surgeon for veterinary orthopedic surgeon, looked into could we find a way of offloading that weight that's going onto those pads surgically and more effective maybe than just cutting the corn out and letting it come back and treating it again. So the idea he came up with was could he cut the tendon, which would offload the weight from the paw. And this really has background already in horses, where we cut the tendon back of the lower part of the leg to sort of relieve the pull on the hoof and the pressure on the hoof. And also, it has been tried in humans in diabetics to offload what we call pressure ulcers on the end of toes. So you can see the surgeon here just going a very simple operation, just going in almost blindly with a scalpel to cut the tendon to relieve the weight on the toes. And over time, as you can see, there was the diabetic ulcer on the left before treatment, and then after treatment, it heals over time. So there was a background to it, there was a history to it, and what we did, or what Mike did, was take that and apply that to the veterinary situation. So essentially, different indications, different species, but the same principle, offloading all that weight. So a little bit about the tendons of the toe of the dog. There's two tendons at the back and one at the front, simplistic. One is a deep digital flexor that goes to the end bone toe, and the other is the superficial, which goes to the middle toe, bone toe. Just a little bit that terminology. Tenotomy, it essentially means that you're cutting the tendon. Tendinectomy means that you're removing. Ectomy, or ec means to cut out by the tendon. So they're two subtly different operations, but they're both on tendons. So the idea was, firstly, if we cut both tendons, the end toe would suddenly sort of flip up and the weight wouldn't go onto that. So here you can see this again is a picture from Mike, where he's isolated the tendon with his forceps, and then we'll go on to cut that. And what happens is the toe flicks up, doesn't sit on the ground, and you've essentially taken the weight off that. Exactly the same as the human podiatric surgeon is doing, exactly the same as the equine surgeon is doing. And here you can see, I just want to show you a picture of a dog before the operation. You can see limping, head going up and down. That's very indicative of animals and dogs that head to sort of shift the weight with their head and their body. There we go. Oh, let's see if we can stop him. He's going around for one more go. And then this is after the operation. And you can see it's almost normal. So this has really changed. No pain for that dog at all. Coming back, you'll see it a little bit clearer because it was the front leg. A beautiful gait. The head's not going up and down. Keen to pull on the lead to go wherever he wants to go. So once you develop the surgery, the only thing owners often said, they didn't like the way the toe sort of stuck up. It looked cosmetically very unpleasing. So the next question was, maybe it can be more subtle. Maybe it can offload a little bit more in a nuanced way by just cutting, for example, the superficial digital flexor tendon that goes to the middle bone, which would subtly change the weight. Again, this is a picture of Mike isolating Mike's hands, isolating the superficial digital flexor tendon with his forceps, and he will cut a piece out of that, and that will then be treated. And as you can see, cosmetically, the toe isn't sticking up, so it's much better. The next thing is do we need to take a tendon out? And this is quite interesting, because when we just cut the tendon, we know that a large proportion of the tendons re-heal. That's quite interesting, because traditionally we've never thought of tendons as being a particularly good healing tissue. But in fact, in this case, when you cut the tendon, if you don't cut a piece out, you start to get the tendon reforming and re-healing over the course of a few months. So we decided that it was probably best if we took a section of tendon out, so it would sort of slow down the healing and make the tendon rejoining less likely. Again, this is something that's been done, for example, in clubfoot in children, in humans, where often they cut a tendon, and they found if they just cut the tendon, then you have rehealing very quickly. But if you cut a piece out, you can not only lengthen the tendon, you can also avoid it healing too quickly. So recently, Mike has been sending me tendon bits to have a look at them under the microscope. And also we've done a study to see does the amount of tendon removed actually affect whether it recurs or not. And we find if you just cut the tendon over time, you will get most tendons will reheal and you get the corn coming back. But if you cut over 10 millimeters of the tendon out, the chances of the lesion recurring is very low. We've had a look at the tendons under the microscope, and interestingly, all the tendons associated with corns have been highly damaged and have what we call tendinopathy changes. So essentially repair changes in them. If you look at the top right-hand side, it's a normal tendon. The one saying A, it's very flat, sort of straight structures. And then when you look at a tendon that has been from a corn dog, you can see that the fibers are very disorganized. So we also see that, and we've also correlated this with outcome, and we've seen that if the dog has a very severe tendinopathy, they're more likely to the corneas to come back after surgery. So from this, superficial digital flexor tendon has really become the standard treatment, and this has been a long road through learning from what horse surgeons and human surgeons have been doing to really finding a solution for this. And it's interesting that now we start to think could this be a treatment for digital corns in humans? Because people treat diabetic ulcers, but people haven't tried this for people with chronic corn problems in humans. So maybe the information will flow back, and then that will start a new line of investigation in our human two-legged patients. The next thing, and the final thing I'll talk about, is just genetics. We want to see if we can learn something about, is there a genetic component to that? What can we learn from the biology if we find a genetic component? And this is interesting also from a human factor, because no research has been done on the genetics of plantar corns in humans. So we started what we call a genome-wide association study with Frode Lingås at the veterinary school in Norway. We had anecdotal evidence that from breeds and trainers that there was an inherited component. They noticed certain males, lines from males had increased incidence of corns, and it seemed like it often occurred in litters. So we thought that maybe heritability, the fraction of that, for example, corn, the number of corns, are they associated with particular genes? And we found when we looked how heritable there was, so how likely it is to be due to genetics, was about 63%, which is actually quite high, because when you look at other dog breeds with other types of diseases, we're looking at hip dysplasia, maybe 0.3 to 0.4. We're looking at things like deafness being 0.2. So 0.63 was incredibly high heritability. So then we decided to go into the molecular world and start to look at the genetics. And we wanted to do this for two reasons. Firstly, to see, are there some genes associated with corns in dogs? And if we do find those, then we want to transfer that and say, are those genes that cause corns in dogs also present in humans who get corns? So again, a one medical approach. If you look at this, it's just to show that dogs are so much easier to do these type of genetic studies with because of the breed system. So we've selectively chosen certain dogs to have certain traits, and that means there's been sort of genetic bottleneck, which has meant that there's much fewer genes, much less variation in genes. So for a study, you want to find a gene in humans, you may need maybe 10,000 to 20,000 patients. In a dog study, you may only need maybe 50 to 100 dogs. So it makes those studies much easier. And if you identify genes in dogs, then you can go to humans and see if those genes are also present at an increased instance in those. So it's a very good start and a very cheap start in a way. So this is a sort of readout you get. At the bottom, there's a number of chromosomes, and it shows how probable a particular area of that chromosome is associated with the disease. So this is what we call a Manhattan block, because it looks like sort of towers in Manhattan. And it's just really to show anything above the blue line is something of interest to us. How many dogs do you need to have to show a complex disease? Well, it says a study was done by Cornell Veterinary School, which found really you need maybe between 500 and 1,000 dogs to show a very, very complex, what we call polygenic, i.e. there's many, many genes involved, to find those genes. So here you go, it's about 500 to 1,000. So currently we're doing that study. We're now up to 800 dogs. We're busy analyzing it. And our hope is in this study really to transfer this knowledge over to humans and also understand human corns better. Not only to understand the biology better, but maybe to also find maybe better non-surgical ways of treating corns. And this is really where we see the One Health approach, using this, what we see in humans and what we see in animals. And I don't think we should see animals as being a model for humans. They're just exactly the same disease, but there's a synergy of knowledge going between them. So one's not necessarily being used as a model for the other. They're just together, feeding off each other with the information we know, with the epidemiology, with the pathology, and seeing what can we conclude, what can we find out from each other. And just coming back to the horse, a very interesting, very beautiful article from a One Medical point of view by Bach and Bosch in the Netherlands, who reported on corns in the equine hoof. Here you can see on the right a picture of the corn, and after they've removed it with the deficit, with the space in thing. And in their article, which is incredibly, I think it's been overlooked by a lot of people, but they talk about what can we learn from the human hoof corn and the human corn. And I think it's such a beautiful short article, which really pulls in the essence of one medicine. But also behind this is also a bigger image of, or a bigger interest in biology, which One Medicine contributes to. By this approach with modern medicine, we can start to find out even more information about biology in general. So, for example, how keratin, how that hard tissue forms. And so there's not only what can medicine learn from each other, but what can also this One Medicine approach contribute to biology. And here is, I'll try and pronounce it, Acanthostega gunnari, which was one of the first animals to go from water and start walking on land. He developed these 4 limbs. And what is interesting is, to be able to go on land, you can't go on. If you've seen a fish on water, fish on land, it destroys its skin because it doesn't have any keratin. So these animals probably developed, had to have some sort of keratin production to be able to go on. So to learn what are the stimuluses, what are the controls of developing keratin, we may be able to learn a little bit about that from these models from humans and or these patients with corns, both human and canine. So that's really everything I wanted to talk about. A massive thanks to, I have to mention people who have sponsored Greyhound Health Initiative, which is an American charity, is absolutely amazing. It has supplied money and got patients for us, bought swabs for us. Also the Agria Forskningsfund, which is, Agria is a Swedish animal health insurance firm, which also supplied us with a grant. Also, the help from the Norwegian Veterinary School, Norwegian University of Life Sciences, but also the Australian Companion Animal Health Foundation has contributed funds to the genetic research. And thank you to all of them, because without money, research just doesn't move forward and these ideas don't get developed. So that was everything. I hope you enjoyed it. What I'd like to emphasize is this is a collaboration between medics and vets on equal footing, and what can we learn from each other? And I think the Human Animal Trust is a fantastic charity that really uniquely is creating a forum for that to happen. And so for that, they should be applauded. Thank you very much.
Thank you, Richard. And I want to applaud you for that incredible presentation, but also for the fact you made me interested in corns, which is something I never thought would be at all possible. I just wanted to ask a question, if you don't mind, regarding preventative measures. So we talked about surgery. Obviously, and that always seems a little bit extreme, doesn't it, to have surgery? Is that because with corns, you can't see the symptoms as soon as they start to appear? So you have to almost wait for the dog to be lame or to notice it on a human foot, and then it's already too late? Or is there anything we can do for either ourselves or our animals to actually, as soon as we know it may be happening, to prevent it from getting worse?
Yeah, that's a really good question, and I think probably, unfortunately, you're correct that when you start seeing the clinical symptoms, the pain, the lameness, I think essentially you're probably a year behind. You know, you're seeing the end result of a long chronic process, and this is really why we've been thinking about maybe the genetics may help us. So, for example, if we can in the greyhound side, if we can find dogs that for example, have a combination of genes that we know have a higher incidence, maybe we can start thinking about, okay, we can do ultrasound on their toes just to see how, is the tissue under the toe and between the bone degenerating. And we're thinking also if we can do that and find genes relevant that are also relevant in humans, maybe, for example, when they start to get high risk factor diseases like diabetes, maybe ultrasounding these areas where we know corns can develop. And if you think about a corn, once you get a corn, you're probably going to get in a diabetic, an ulcer. So we want to prevent it. So maybe screening with, for example, ultrasound in these high-risk patients that we know develop calluses, know develop corns, could be the future. But that's really where we're thinking. And I agree with you. This is the end stage of a long process. So at the moment, we're not quite there that we would know what to do. But that's why we hope to get more knowledge about it. And you're absolutely correct that surgery seems like it is a minor surgery, but surgery is surgery. And a lot of owners are very reserved to do the surgery because their dogs are old or they're high anesthetic risks. So we do want to find another way of preventing, that's the ideal, or if not, medically treating these animals.
Brilliant. Thank you very much. Has anyone else got any questions? There isn't any others in the chat. But if there isn't, then I just want to thank you so very much for your time, Richard, and all that you're doing for One Medicine. Because as I said at the beginning, you are One Medicine with your veterinary work and your human medical work. So thank you very much on behalf of everyone at Human Animal Trust. We are so very grateful for your time and your commitment to this cause. Thank you.
Thank you very much. Thank you. Good afternoon.